you ever been in a situation where you desperately needed to use the bathroom but couldn't find one nearby? Maybe you were stuck in traffic, or in the middle of a meeting that just wouldn't end. We've all been there, and the temptation to hold it in can be overwhelming. But is holding your pee really harmless? In this video, we're going to explore the question of whether holding your pee is dangerous, and the answer might surprise you. From the risk of infections to bladder damage and kidney problems, we'll uncover the truth about what happens to your body when you try to hold it in for too long. So, buckle up and get ready to learn everything you need to know about your urinary system and the risks of ignoring its calls for relief. The urinary system is one of the most important and fascinating systems in our body. It's responsible for filtering out waste and excess fluids from our blood and producing urine, which is then eliminated from the body. The kidneys are the workhorses of the urinary system. They filter up to 200 liters of blood per day and produce about 1 to 2 liters of urine, depending on the body's needs. The urine travels from the kidneys to the bladder through two tubes called the ureters. The bladder acts as a storage unit for urine until it's ready to be released. When the bladder is full, it sends a signal to the brain that it's time to go to the bathroom. The brain then sends a signal back to the bladder to start contracting and pushing the urine out through the urethra. This process is called micturition, or more commonly known as peeing. What's interesting is that the urinary system is a highly regulated and precise system. It balances the body's fluid and electrolyte levels, and even adjusts urine production based on factors like hydration levels and sodium intake. It's also influenced by the body's circadian rhythms, which can affect urine production and bladder emptying patterns. In fact, the urinary system can even provide important clues about our overall health. For example, changes in urine color, odor, or frequency can indicate underlying medical conditions like kidney disease or diabetes. Holding your pee may seem like a minor inconvenience, but the truth is that it can pose serious health risks. One major risk is that holding your pee can lead to urinary tract infections, UTIs. When you hold your urine, it creates a warm and moist environment in your bladder, which is the perfect breeding ground for bacteria. These bacteria can multiply rapidly and cause a painful UTI, but UTIs are not the only problem that can arise from holding your pee. Holding it for too long can also cause bladder damage, which can lead to urinary incontinence. This means that you may have trouble controlling your bladder, leading to embarrassing and inconvenient accidents. In extreme cases, holding your pee for extended periods can even lead to kidney damage. In fact, there have been documented cases of people who suffered from serious medical problems because they held their pee for too long. For example, in 2007, a woman in China reportedly suffered a ruptured bladder after holding her urine for an entire day. Similarly, a man in California developed a serious kidney infection after regularly holding his urine for hours at a time. The urge to urinate is an important signal from your body telling you it's time to go. But why do some people feel the need to go more often than others, and what factors can influence the intensity of that urge? Here are some interesting factors that can affect the urge to pee. Age. As we get older, our bladder becomes less stretchy and holds less urine, leading to more frequent trips to the bathroom. Caffeine and alcohol. These substances are known to irritate the bladder and increase the urge to urinate. Pregnancy. As the uterus expands, it puts pressure on the bladder, causing women to need to urinate more often. Certain medications. Diuretics, antidepressants, and blood pressure medications can all affect bladder function and increase the urge to urinate. Anxiety. Stress and anxiety can cause the muscles in the pelvic floor to tense up, leading to a stronger urge to urinate. Medical conditions. Conditions such as urinary tract infections, interstitial cystitis, and overactive bladder can all cause increased frequency and urgency of urination. Dehydration. Not drinking enough water can cause the urine to become more concentrated, leading to a stronger urge to urinate. Maintaining good urinary health is crucial for overall well-being. Here are some tips for promoting healthy urinary habits. Drink plenty of water. Staying hydrated is essential for keeping the urinary system healthy. Drinking water helps flush out toxins and bacteria from the bladder and kidneys, reducing the risk of infections. Practice good hygiene. Keeping the genital area clean and dry is crucial for preventing urinary tract infections. Wiping from front to back after using the toilet can also help prevent the spread of bacteria. Empty the bladder regularly. Holding urine for too long can increase the risk of infections and bladder damage. It's important to empty the bladder regularly, at least every 3 to 4 hours, or whenever you feel the urge to go. Avoid bladder irritants. Certain foods and beverages, such as caffeine, alcohol, and spicy foods, can irritate the bladder and worsen urinary symptoms. Limiting or avoiding these bladder irritants can help promote healthy urinary habits. Practice pelvic floor exercises. Strengthening the pelvic floor muscles can help prevent urinary incontinence and improve bladder control. Kegel exercises are a simple and effective way to strengthen the pelvic floor muscles. Seek medical advice if needed. If you experience any urinary problems or concerns, such as pain or burning during urination, frequent urination, or blood in urine, seek medical advice promptly. Early intervention can prevent more serious health problems down the road. By taking care of your urinary system and practicing good habits, you can reduce your risk of developing any complications. Don't forget to subscribe to our channel for more tips and tricks to maintain a healthy lifestyle. We'll keep bringing you informative content to help you stay in the best shape possible. Take care of your body, and it will take care of you.